Holly, how are you?
I'm good, thank you. How are you?
I'm marvellous, thanks very
Yes,
much.
fabulous. What have you been up to?
I've had 3 days off, which was fantastic. I know, I was a mum for 3 days. It was brilliant. I
Oh,
loved it.
I bet
Um,
that was really well received by family.
yeah, apart from that, not a lot, the same as everybody else, desperate for a haircut. But yeah, I think we're all counting down the days till those easing of restrictions start. But yeah,
Yeah,
working,
all
Holly, that's
all
what we
looking
do.
forward to it, aren't we? These easing of restrictions.
Yes, it'll be brilliant. It'll be so lovely. I can't wait. I'm looking forward to seeing another friend in my garden or outside soon.
Yeah, it feels like a right treat, doesn't it? Another
And a
person.
whole other person I can see. Yeah.
Right, so we've had a few questions come in, which is great. So thank you guys for sending in your questions. And let's just dive in. So the first question is, have there been or are there any updates on what will happen for those of us who are currently working from home?
So there's no update to that. Please carry on working from home. There's no expectation at all that that's going to change in the foreseeable future. The route out of lockdown is really clear in terms of people should continue to work from home until at least the summer. So we've just started a recovery programme, which is quite an extensive piece of work that's looking about what we've learned from the last year, 18 months, what we want to keep, and also then the consultation with colleagues around what they liked and what they want to keep. So we're going to be working through that, but at the moment, there's absolutely no change. Please stay
Okay,
at home.
perfect. And I mean, as always, we'll let people know, but the question's a good one because it's not been asked for a little while. So thank you. Um, Next up, we've had how are we making sure during COVID that families and carers are still involved in the care and support of patients? Because it's been particularly challenging with things such as visiting restrictions, remote consultations, and treatment.
Yeah, so nothing's really changed actually on that. So families and carers are still very much as involved as they were before. So where a family member or carer were invited to a consultation or appointment, that still happens. It just means it happens sometimes in a technology-based way rather than face-to-face. There has been some more visiting restrictions, as people are aware. Those again will start to lift shortly, but there has always been the ability for individuals to be with their families and their carers if that's part of their care plan. So yeah, nothing's really changed that much on some of that. If people are worried about carers, that they're not getting the support they need, there is more information on carers.org, I think, or Carers UK. So I
Okay,
can send you those links, Holly, that we can put on the staff room.
that would be amazing. Thank you. Yep. So we'll link those in the article below. The next question is quite a topical one. Do we need to worry about the AstraZeneca and blood clot link?
So there has been no evidence at all which indicates that there is a higher likelihood of somebody having the COVID vaccination to develop blood clots. I think I actually heard on the news this morning that Italy and France are now lifting their pause. So I think there was initially some worry, which I think has now been alleviated. Obviously, people are aware that the World Health Organizations and the EU health teams are saying that there's no evidence of any link. So no, at the moment, there's no evidence that would suggest that you need to be worried about that. And there has been, I think now 11 million, what they're saying on the news this morning, vaccinations worldwide of the AstraZeneca, which is phenomenal. And I know that we are really pushing that through. So if you are invited, or if any of your family members are invited to go and have that vaccine, please go and have it. It is so, so important that we vaccinate as many people as possible.
I took my mum this morning to have hers because we drowned our car in at Christmas, so she can't drive. So I took her this morning, and she was like, "It was great. There were soldiers, there were nurses. It was fabulous." So she would highly recommend it.
I'm just waiting. My husband's now, because he's over 50, so he's tipped into that 50 to 55 category, which I think they're contacting this week. So as soon as he gets that text message, he'll be down the street to get his vaccination, definitely.
Here's my arm.
Yep.
Perfect. Okay, so Oh, this person has asked, they're about to have their second vaccination, but do they need to continue their lateral flow testing once they've been fully vaccinated?
Yes, absolutely. So really clear message that lateral flow testing needs to continue. We have until we get any messages from the government that we need to stop doing that, or from Central NHS England. Please continue to do your lateral flow testing. Yes.
Perfect. Okay. Really clear answer to that one. Just keep doing it. All right. So the next one is uh, about the vaccines that are happening at Kettering General Hospital. People who've had their first vaccination at Kettering General have, on occasion, been sent more than one appointment for their next vaccination, but aren't actually able to get a response from the email address to try and sort out which one is which. So if they are those people who've had the confusing which appointment should I go to, what should they do?
So I think there has been quite a few problems with the bookings at KGH. I think it's just the volume of stuff we're trying to get through, and I think there's different systems that people are using. There is a number that people can phone up and get clarification on their appointment. So again, Holly, pop that in your response bit rather than me reading out the telephone number.
Everyone remember it here and now. This is it. No. Okay, so next up is about staff who had their vaccination with our NHFT team at Northampton General, but they haven't yet had their booking for the second dose. And this person is worried that they're going to miss that 12-week gap. So what should they do?
So this has been a really, really carefully managed process. So everybody who had their first vaccine was reported into, well, not the names, but the numbers of who had their vaccines went through, and that has then led to the stock deliveries for the second vaccine. So it's a push model, so it's all coming out from Central in terms of the vaccinations. Liz and her team have done a remarkable job. So she's got everybody scheduled in. You might not have been contacted yet, but people are all booked in. I think she said the 15th of April. Everybody who's had their first vaccine at Summers Unit will have had their second. So
Wow.
please be patient. Liz's team will be in touch with you. And yes, absolutely nobody will miss out. And I think she's trying to do it at 11 weeks. I think that's what they're aiming, so it gives them a week's grace. But yeah, everybody will have had theirs by the 15th.
That is so exciting. Oh my goodness. I can't wait. Well, they are all the questions that I had for you. So that was whoosh, we did a really great job. If I could high five you, I would. But have you got anything else you'd like to say to Team NHFT?
Just as I always say, and I don't think you can say enough, thank you, thank you, thank you, thank you, thank you. I hope everybody has an opportunity to take a rest, a well-deserved rest over Easter. It's really important. If you can't have time off on the Easter weekend, please take some time off. Take some time off to be with your family, and please book your leave. Start to think about and book your leave from next year. So we know that, I think it's is it 17th of May? I don't know, I've got these dates in my head. Some of the restrictions will start to lift further. Please have a look at that, and please book your leave. It's so important, honestly. After having 3 days off, I just feel so different, and everybody needs to be doing that. Even if you can't go anywhere, book some time off. But thank you very much, everybody, for continuing to be brilliant.
Thanks very much.
It's true, Holly. You have been brilliant. You've been brilliant. All the people that are working on the front line have been brilliant. Everybody that's working in all the different services across NHFT have been phenomenal. So it's just great, isn't it? It just makes you realise how lucky you are to work somewhere like NHFT.
No, that's perfect. Thank you so much, Jane. Thank you for coming on and joining me again. And we will be back next week with another Ask a Director. And I'm going to say it's Simon Harris next week, who we've never had on. So get your questions in.
Make them really hard for Simon. Come on.
You heard it here first, guys. Make them really hard for Simon. All right. Thank you so much, Jean. Take care, everyone. Bye.